topic, which is called Vibrio cholera. What we need to know about Vibrio cholera is that it is an intestinal infection. It kills very fast. It kills a lot of people. Nowadays, it remains to be very actual infection. And especially it is a big problem in two cases, or in countries which are not industrialized, or in countries which doesn't have centralized water installations and centralized sewers, centralized rest waters, or in cases of natural disasters. This is how nowadays, on the one side, in some poor countries or in some poor regions of some countries, we have cholera to be endemic, and in such places Vibrio is circulating. As example, in Africa and in India, there are some regions in which people are using same water, same sources of water for cleaning, for cooking, for drinking, and same sources of water they are using as sewers, they are using as rest water. Cholera is making part of family Vibrionoceae, genus Vibrio, and the species which are able to cause this disease. Actually, it is Vibrio cholera, which can have more serotypes and more biotypes. But namely, Vibrio cholera is producing that very infection called cholera. And here on this picture you can see difference. This is a famous picture of the same young girl which had cholera. It's very old picture. The same girl were drawn before and after, immediately after few hours of infection with cholera. So you can see how does it change the appearance of the person. Vibrio cholera is used to be found in sources of water. It can survive in both salt and fresh water. Even if there are more common sources of fresh water for cholera, it can survive very good in the sea, in salt water. But why we know more cases of epidemics with the source from the fresh water, it is because freshwater sources are smaller, there are more people using this water, and in the sea, in the ocean, any pathogen is dissolved it dissolved faster, and it is there are less chances to get an infection from the sea, just because it is bigger. But actually Vibrio cholera is living very good in salt water. There are only two types of two antigenic types of Vibrio cholera, O1 and O139, which are toxigenic, and O1 has just two serotypes causing infection. It is classical infection and classical serotype and serotype L-TOR. Vibrio cholera is gram-negative bacteria. It is very motile. It is monotrichous because it has one flagella on the one side. And the main factor of pathogenicity is cholera toxin, which is producing that characteristic symptom of cholera. Strains causing epidemic, we have O1 classical strain, and we have O1 L-TOR. And strains characteristic for India and Bangladesh, which are endemic for cholera, is O139. Talking about spreading of this infection, till now we had, during 2 last centuries, we had 7 global pandemics. So even now we are in that last pandemic, which involves nowadays just few countries. Also, cholera is called somewhere it is called Blue Death, and it was killing a lot of people, basically because it has ability to produce very strong and very fast dehydration, and the person is dying without water. So it is very common in India, in Africa, lower Sahara desert, and also in southern Asia. So it doesn't really affect too often industrialized countries, because there is a very high division and very good division in industrialized countries between clean water and wastewaters, and it is to be under control every day, all the time. And this is why it is much lower risk to have this epidemic in countries with centralized supply of water. Here you can see a few pictures of reasons which could cause epidemic of cholera. So usually, if the pathogen is present in the water, there are a lot of people who are not having access to the clean, pure water, and this is how they have to use the water they have. So again, the reason people could have this infection, or they don't have in their countries, in their villages, in their locations, they don't have pure and centralized supply of water, or it is about natural disaster. For example, in United States, after hurricanes, sometimes there are some eruptions, there are some cases of cholera. Of course, very soon and very fast they are localized, but anyways, in zones, in regions with high, with often hurricanes, there are a lot of cases of infection after such natural disasters. Also, some time ago, it used to be in Haiti. After strong earthquake and strong tsunami, it was flooding there, and of course all the sources of water were polluted with a lot of pathogens, which are bringing epidemics, including epidemic of cholera. This is how it looks in different countries and in different places. So the transmission is through the contaminated food or water. Much more often it is through contaminated water, and on the second place it is food. But the food also has origin from the water, or the food wasn't washed with clean water, it was contaminated water, or it is about improperly cooked fish. So this is the main way. Actually, the mechanism is fecal-oral transmission, because the bacteria is multiplying in feces, in gastrointestinal tract, in different animals, and in humans. So if sick people are eliminating the pathogen, that water, those liquids eliminated from the patient are not to be thrown out in the source of water. In this way it will be contaminated, and it will increase incidence of infection. So here you can see how the infection is spreading. The transmission is fecal-oral. Feces of the infected person contaminates water supply, and as a result it produces diarrhea, which makes it easy for bacteria to spread in such conditions. Even if everyone is very receptive to this infection, high importance in pathogenicity and in infection are making people with low gastric acid level. So Vibrio cholera doesn't resist in acid media. It prefers basic media, alkaline media. And some doctors were saying that it is very good method of prevention to drink 1 glass of wine before every meal in order to prevent cholera, because one glass of wine will increase the acidity in the stomach. Of course, it is not the best method of prevention because of few reasons. First of all, people who are promoting treatment or prevention with alcohol probably are not following the medical reasons, but actually they are looking for excuse to drink. And secondly, a lot of people do not have measure. So some people are saying, okay, if I will take 1 glass of wine, it will increase acidity a little bit. If I will take few glasses of wine or even more, it will help even more. And a little bit it helps. Afterwards, the organism is looking for the balance. So on the moment, organism feels that it is too much acidity in the body, and the organism decreases the level of acid in the body. In such way, the media in the body becomes more alkaline. So our body is looking for the mostly balanced condition for itself. So it will not be the best solution. Other risk categories it's about children, like they are 10 times more susceptible than adults, and elderly people. Elderly people are more in the risk because they are making dehydration much faster. Regarding blood types, the mostly affected is O1 group. On the second place 3B, on the third place 2A, and on the last place, like less affected, is 4AB blood type. And how long the patient is contagious? The person with acute stage is contagious all the time. So as long as a person has symptoms, that person is contagious with Vibrio cholera and is representing a source of infection. Also, a few days after recovery, so if the patient already doesn't have any symptoms of cholera anyways, you should wait few days just to make sure. It can be even up to 1 week. When the person is already not infectious. But anyways, 70% of patients are keeping the bacteria inside during the entire week after the infection, and by the third week, 99, so by the end of the week, 70% are non-infectious. Like about 30% can be still infectious by the end of the week. And by the end of the third week, 98% are becoming non-infectious. Regarding incubation, it can vary between few hours and few days, but usually up to 5 days. And average is between 1 and 3 days. The shorter incubation period can be due to acidity of the stomach, or due to consumption of the high dose of bacteria of the pathogen. Regarding symptoms also are very important. So usually after the incubation period, the person will start present some symptoms. And what is important, that about 75% doesn't have any symptoms. 20% of people, they have mild symptoms of disease, and up to 5% they have severe form of infection. And symptoms are vomiting, cramps, watery diarrhea about 1 liter per hour, and without treatment it can lead to death in few hours, like by the end of the day or up to few days, independence of how severe is the disease. The patient without any treatment can die because of diarrhea. If we are talking about more severe form of cholera, which is called cholera gravis, first of all, it has more severe symptoms. And severity of symptoms basically is included in the amount of the bacteria, in the amount of water lost with that persistent diarrhea. So if in the simple infection we have watery diarrhea about 1 liter per hour, in cholera gravis we have up to 6 liters per hour. So of course death can occur much faster, even in 2-3 hours, but not longer than in 12 hours. And because of this huge loss of liquids, we have rapidly lose of more than 10% of body weight. And whenever these 10% are making part of just liquids, it is an extremely big problem. Also, it produces that severe form of cholera means that we have too much bacteria in the intestine. So very high amount of bacteria will be found in the stools, and untreated, this disease will lead to very, very fast death. Which are consequences of this infection? First of all, it is decrease of the intravascular volume. It is severe metabolic acidosis, as well as we are losing too much, not just liquids, but also we are losing all the minerals from the bloodstream. It will lead to hypokalemia. So it will decrease amount of potassium in the bloodstream, which can lead to the cardiac failure, and also decrease of filtration of the blood will lead to renal failure, and of course sunken eyes and decreased skin turgor. Skin turgor means ability of the skin to take back its form. So normally every person has normal skin turgor, which means whenever I'm taking a little bit of my skin, from the moment I let it go, it comes back. In case of cholera, even if I will take back my fingers, the skin will stay like this, because the turgor, elasticity of the skin are decreased. It is due to loss of liquids. And of course, because of loss of liquids, we almost don't have any urine production. Regarding diagnosis, since Vibrios are highly motile and gram-negative, it is very easy to detect them. Also, they have specific shape. They are comma shape or curved bacteria. So it is comma-shaped rod. It has just one flagella on the one side, so this is why it is called monotrichus. And they are growing in the media which contains an inorganic nitrogen source. So this bacteria prefers more nitrogen, it prefers more minerals, and it prefers alkalinic pH. So they are growing very fast. In adequate media, they can grow even in 30 minutes. This is why the infection can start that fast, because the bacteria is multiplying very fast. And they prefer the solutions with alkaline conditions. So pH below 6 are considered not to be appropriate for these bacteria. Talking about the mechanism of action of the pathogen, we were talking about the fact that the main factor of pathogenicity is cholera toxin, and this toxin has very specific function. So if we are talking about other intestinal infections which are producing inflammation in the intestinal tract, and due to this inflammatory process there is increased motility of the intestine, which leads to diarrhea. In case of cholera, there is a little bit different, because there is no inflammatory process itself. There is a process which changes the function of the epithelial cells of the enterocytes. So as well as you know, the enterocyte of the large intestine has its main function of absorption of the water. So the cholera toxin has ability to attach to receptors of enterocytes. In this way, it blocks few channels in the enterocyte, and the function of the enterocytes turns backwards. In this way, the absorption of water, which is supposed to be from the intestine into the bloodstream, it turns the function of the enterocyte backwards. So absorption of the water happens from the bloodstream in the cavity of the intestine. In this way, the bacteria is multiplying, the bacteria is producing its toxin, this toxin is getting in contact with enterocyte, and enterocyte starts absorbing the water from the bloodstream, and water flows in the intestine. In this way, diarrhea starts. In the beginning, feces, they have their classical aspect, because first portion of feces are containing the actually feces themselves, but next, since the intestine is already clean and free of feces, just the toxin keeps its function, and bacteria is keeping multiplying on the in the surface. And here, motility of the bacteria makes very high importance, because the bacteria has to persist somehow in the space in the cavity of the intestine, and if the bacteria wouldn't be motile, the water which flows through the intestine which would wash the bacteria out. But since the bacteria is highly motile and is able to flow against the water is going out of the intestine, it is able to stay and persist in the intestine and to produce continuously that infection. So the treatment, uh, of course, it would be very good to apply some antibacterial treatment, but the main part of the treatment is not etiological, is not against the pathogen itself, but against the symptoms, because symptoms are killing the patient much faster than pathogen itself. This is why the patient is to be rehydrated. So if the patient has just diarrhea, the best way of rehydratation is supply with water and with liquids and with electrolytes through the orally, through the enteral way. But if we don't have this possibility, and it is in case of vomiting, because sometimes diarrhea affects just intestine and produces just diarrhea, and sometimes it affects not just intestine, so it goes upper and it produces vomiting. So in such case, of course, the patient is not able to drink, because everything the patient will try to drink will get out. In case the patient doesn't have a opportunity to recover lost liquids, of course, we will apply parenteral supply with liquids. So also it is very important to keep all the liquids the patient lost and to not throw these liquids out till the end of the treatment. And there are two reasons why don't we throw out all the liquids patient have lost during the disease, during the infection. First of all, before we will throw them out, we should decontaminate them, we should disinfect them. Unless we disinfect these feces or vomiting masses, we are creating danger for the population with this infection. This is why we should first of all to apply the treatment for the patient and to keep all the liquids lost by patient and to decontaminate them, to disinfect them, and just afterwards to throw them out. But the main reason why don't we throw out instantly all the liquids patient lost, in order to know which is that amount the patient is to get back. So you know how many liters, which is that amount of liquids patient lost, and we know how much liquids the patient should get back in order to have rehydratation. So we are giving the same amount the patient lost and a little bit more in order to help the patient to recover. And of course, on the second place, we have, after rehydratation and recovering of all the electrolytes lost by patient, also we can apply antibacterial treatment. Talking about prevention, of course, prevention is on the first place is cooking properly everything on the level of the person. So it is personal hygiene, it is using of properly boiled or cleaned water. Don't use the same source of water as source of water and as a waste waters. And of course, there are some vaccines. Not all of them are efficient. The mostly efficient vaccine is vaccine applied orally, and less effective and with more side effects is a vaccine applied parenterally. But the mostly efficient vaccine is vaccine applied orally. And nowadays we are still looking for a new, more efficient vaccine. So it is the the field which we should work on more in order to get an efficient vaccine. And on the level of population, of course, countries with endemic cholera regions, it would be very important to change something in water supply in such countries, in such regions, in order to have division between source of drink water and wastewater systems. This is how can we fight with this disease. So that's all. Thank you for attention.